Looking at your pictures and doing your exam, the areas that we talked about are particularly this area, kind of in your outer thigh here.
Well, what is the difference between smart lipo and just traditional lipo?
In terms of the procedure, with smart lipo, we actually use a very tiny 1 mm probe to go in, and literally it goes in and liquefies and emulsifies that fat, and then we go in and aspirate it out. It used to take a painfully long time to do the liposuction, and now this allows us to do it in a much more efficient manner, and it's much less traumatic to the body and a much smoother contour. The other significant benefit of smart lipo is that we get the opportunity to have skin tightening with this type of liposuction, and the others don't really provide that.
So with smart lipo, am I still put under, or am I awake as it's done in the office, or where?
Well, the benefit of the smart lipo is that we're able to do it in the office because, as I mentioned, we're able to use very small probes. We usually just give you an oral sedation and a pain medicine, but it's able to be done in the office just with the medicine that we put in.
What are the typical areas that you treat for the lipo?
Everybody, is different with regard to where they sort of store their fat. But there's some times where people will just have a little fat, for example, around their hips or their tummy, their outer thighs, or even the lower back area. So those are sort of focal areas. The sites that we use as access points are these little points here. So basically there's usually 2 on each side.
Will those leave scars?
They're tiny. No, first of all, they fade very well, but they're literally only about that long. So they're real little.
What is the typical downtime, and how long will it take before I can expect to see results?
So that's a good question. One of the, again, benefits of doing the smart lipo is that there's a lot less downtime. Again, because the probe is so much smaller, we just don't have the same pain that we did with traditional liposuction and even with the Vaser liposuction. You will get some bruising and some swelling, but usually that's pretty minimal. I tell people that, for example, if you have the procedure done at the end of the week, you can go back to work on Monday, particularly if you have desk jobs and things like that. You will see some immediate results, but really for that swelling to go down, I would say probably you should say at about 6 weeks, you should see a very good result.
Okay.
Now, a lot of the tightening that occurs, that may peak at about 6 months, and so while you may see some tightening immediately, the peak of that particular tightening is going to be at about 6 months from the time of the surgery.
Okay.